When managing diabetes, it's easy to focus solely on blood sugar levels, dietary choices, and exercise routines. Medications are often seen as reliable tools that help maintain control, but many of them come with hidden risks. These potential dangers aren't always obvious at first glance, yet they can impact overall health, quality of life, and long term diabetes management. Exploring these hidden pitfalls can help you make informed decisions, work more effectively with your healthcare provider, and take a proactive role in your care. Before we continue, I'd like to tell you about Diasalon, a powerful blend of 13 natural ingredients, each carefully selected for their proven ability to support healthy blood sugar levels, enhance insulin sensitivity, and promote overall wellness. You can read more on diasalon.com. One potential concern with certain diabetes medications is the risk of hypoglycemia, or low blood sugar. This isn't just an occasional inconvenience, it can become a serious issue if it happens frequently or goes unnoticed. Medications that stimulate insulin production, like sulfonylureas or meglitinides, can lead to blood sugar levels dropping too low. While these drugs can be effective, their effects on glucose can sometimes be unpredictable, especially if meals are missed or physical activity increases unexpectedly. Studies have found that recurrent hypoglycemia can strain the heart and nervous system over time, making it important to recognize the signs such as shakiness, confusion, or faintness and address them promptly. Another hidden risk lies in the impact some medications may have on the gastrointestinal system. Certain drugs, like metformin, are known to cause nausea, diarrhea, or bloating in a significant number of users. These side effects might be mild and short-lived for some, but they can persist and become quite uncomfortable for others. For people already struggling to maintain a balanced diet, ongoing stomach upset can lead to nutritional gaps or even difficulty adhering to their treatment plan. Research has shown that prolonged digestive disturbances can also influence gut health, potentially affecting metabolism and overall well-being. Liver health is another area of concern. While most diabetes medications are considered safe for the liver, there are some exceptions. For example, medications in the thiazolidine-dione class have been associated with rare but serious liver complications. Even when these issues are uncommon, it's still worth monitoring liver function through routine blood tests. Identifying any early stages of liver stress can prevent more serious outcomes and help adjust treatment before damage occurs. Kidney health is equally important. Medications like SGLT2 inhibitors, which help the body excrete excess glucose through urine, can strain the kidneys if not used carefully. Research suggests that in individuals with pre-existing kidney conditions or those who are dehydrated, these drugs might increase the risk of kidney damage. Staying hydrated and having regular kidney function checks can help mitigate this risk and keep everything running smoothly. Cardiovascular effects often fly under the radar. While some newer diabetes medications have been shown to reduce the risk of heart disease, others may have the opposite effect. Older drugs, in particular, may contribute to fluid retention or increase the likelihood of heart-related issues. Even if a medication is effective at controlling blood sugar, its impact on the heart should not be overlooked. Taking steps to track blood pressure, cholesterol, and any unusual symptoms, like swelling in the legs or shortness of breath, can be invaluable in catching problems early. Another hidden danger is the possibility of weight gain associated with certain drugs. Insulin therapy, for instance, is a powerful tool for controlling blood sugar, but it can sometimes lead to unwanted weight changes. This can be especially discouraging for individuals who are actively trying to lose weight or maintain a healthy BMI. While insulin is necessary for many, discussing strategies to minimize weight gain, such as adjusting diet and physical activity, can help counteract this effect and improve overall outcomes. Allergic reactions are not always immediately obvious, but can become a serious concern. Some diabetes medications can trigger rare but severe allergic responses. Rashes, swelling, or difficulty breathing are clear warning signs, but more subtle symptoms like persistent itching or unexplained fatigue might also indicate a reaction. Being aware of these possibilities and reporting them promptly can help switch medications before the reaction becomes more severe. Bone health can also be influenced by certain diabetes drugs. Research has shown that some medications, particularly those in the thiazolidine-dione category, may increase the risk of fractures. Over time, this can lead to reduced mobility, discomfort, and complications that further impact diabetes management. Ensuring proper calcium and vitamin D intake, along with discussing other treatment options if needed, can reduce the risk of bone-related problems. Another subtle risk comes from the way certain medications interact with other prescriptions or over-the-counter drugs. This might not always be obvious, but interactions can diminish the effectiveness of the diabetes medication or increase the risk of side effects. For example, some common medications for high blood pressure or cholesterol might alter how a diabetes drug is metabolized. Keeping a complete and updated list of all medications, supplements, and herbal remedies you're taking and reviewing it regularly with your healthcare provider can help prevent potentially harmful interactions. Lastly, long-term use of certain diabetes medications might lead to diminished effectiveness over time. In some cases, what starts as a helpful treatment can become less effective as the body adjusts or the underlying condition progresses. This can be especially frustrating if blood sugar levels start creeping upward despite following the same regimen. Studies suggest that adapting treatment plans regularly and incorporating lifestyle changes can maintain better control and help delay the need for more intensive interventions. Being aware of these hidden dangers doesn't mean you need to fear your diabetes medications. Instead, it empowers you to stay alert to subtle changes in your health, ask informed questions during medical appointments, and take a proactive role in your treatment plan.